full names are Sam Nyurenda, and I work for Africa Directions as a child mentor. I learned that I was HIV positive 5 years ago. When I first learned that I was HIV positive, it was not an easy thing. I was really I had problems with it, and I wouldn't just accept. Initially it was really bad, but as time went by, I have come to accept it.
We have an open door policy for all our programs. We don't specifically target kids who are just HIV positive and kids maybe who are not HIV positive, but we try to integrate the two streams together and try to provide community sensitive and community based programs which deal with HIV/AIDS.
Psychosocial support is essential for families because HIV care and treatment is a complex service, and one of the things that we find most difficult is disclosure and adherence to treatment. With HIV treatment, it is very important that people take their medicines every day as prescribed by their nurse or their doctor for the rest of their life. And psychosocial support helps them to make that happen. Pediatric counselors like Sam are essential to the care and support of children living with HIV. They provide a sense of normalcy for children. They help them to understand their diagnosis. They help families to disclose a very difficult diagnosis to their children. And they help children to just be children, to learn to be like any other child, but living with an HIV diagnosis, but in a healthy way.
The trainings that I did, psychosocial counseling, has really helped me to work with the kids. Because initially, when I started work at Africa Directions, I started as a child mentor, and I didn't understand how to work with children and how to communicate with them, what was involved in it. So after I did my psychosocial counseling, I now came to understand and know the steps and the skills to use when communicating to the children. I love my work. Working as a child counselor and a child mentor, I feel now it's just a God-given thing. I love to interact with kids. You know, in counseling, when you're working with kids, you have to reduce yourself to the level of the kids. And I've always been reducing myself to the level of the children. Even when I'm at home, the people think sometimes I behave like a kid because I'm always with the kids and I interact with them nicely. Sharing my status to the children has really helped the children to understand me and to trust me. Helping children makes me feel good. I love children, and I'm part of them.
So Sam is the link between the children and the parents and Africa Directions. And he goes out in the community to see how the kids are coping. He does house-to-house visitations for all the 20 kids who are under his care as child mentor. He sees how they're living, how they're taking their drugs, the kind of food they're eating, and the kind of environment they have at home, whether the family has accepted the children that they are positive, whether the family understands what the kid is going through, and also helping the child also to positively integrate with other children in the community so that they can live a more fulfilling and longer life.
I'm going to see Patrick and the wife. They live here, and this is their place. So I'm meeting them and meeting the child as well.
Yes, please.
Hello?
Hello. Sam.
Hello.
How are you?
Fine.
Okay.
You okay?
Come in. I'm okay. How are you?
Okay, thank you.
How are things?
Things are okay.
Okay, you can take a seat.
Thank you. Going out visiting homes of people, it really helps my work to really go and identify the children and families that are living positively, and just helping them by giving them enough information that they also go and do the testing. I talk to parents about good nutrition, giving good nutrition. I talk to them about adherence, making sure that they remind their children about taking their drugs normally. It is important to educate parents and guardians about adherence, because adherence comes from the word adhere, which is to stick to, making sure that they are sticking to their medications, because if one is sticking to their medication, then their lives will be prolonged.
We train pediatric counselors in a number of areas using a 2-week course, but one of the areas that we put special emphasis on is disclosure, and how important it is to disclose to children when it's developmentally appropriate. And we use role plays, we use discussion, and we do a lot of talk about what are the advantages of disclosure and what are the disadvantages of disclosure. In clinics where there are trained pediatric counselors like Sam, more children get onto treatment and more children stay in treatment, and that really is a goal of the Ministry of Health of Zambia as well as of the foundation. Our work with the community is essential to the elimination of pediatric AIDS, whether it's prevention of mother-to-child transmission and making sure that a mother who is pregnant knows her HIV diagnosis, or whether it's a child who is repeatedly sick and the family doesn't know that he's HIV positive. We need to be in the community helping them to get the testing and get the treatment, and help them to deal with issues such as stigma and support that need to happen in a community.
The children's spirits are good. They have a morale this time, because initially when we started, before we started the program, the children were not good, and their self-esteem was bad. But the program has really built their self-esteem. I feel to help other people. I feel it is my role as a model to just help them that are still being stigmatized, and I think that's my role.